Welcome to Medicotes, your destination for simplified medical knowledge. Today, we're diving into an essential topic, COPD, or chronic obstructive pulmonary disease. In this video, we'll explore what COPD is, its causes and symptoms, how it's diagnosed, the GOLD criteria used for staging, and finally, its treatment and prevention. Let's get started. Chronic obstructive pulmonary disease, or COPD, is a progressive lung condition that makes breathing difficult. It develops due to airflow obstruction, which is not fully reversible. COPD mainly consists of two conditions: chronic bronchitis, inflammation of the airways, causing persistent mucus production and cough; emphysema, damage to the air sacs in the lungs, leading to poor oxygen exchange. Causes. The leading cause of COPD is smoking. Over 90% of COPD cases are linked to smoking. Other causes include long-term exposure to air pollutants, including workplace chemicals and dust; recurrent respiratory infections; a rare genetic condition called alpha-1 antitrypsin deficiency, which makes the lungs vulnerable to damage. These causes damage the lungs gradually, leading to the symptoms we'll discuss next. Symptoms of COPD can vary, but usually include shortness of breath, especially during physical activity; a persistent cough, often producing mucus; wheezing or whistling sound while breathing; chest tightness, and frequent respiratory infections. In severe cases, you may notice fatigue, weight loss, and cyanosis; a bluish tint in the lips or nails, indicating low oxygen levels. To diagnose COPD, combination of clinical history, physical examination, and blood tests and imaging are used. Medical history. Smoking habits, exposure to pollutants, and recurrent infections play a key role. Spirometry. This is the gold standard. It measures how much air you can forcefully exhale and how quickly. A FEV₁-FVC ratio of less than 0.7 after using a bronchodilator confirms COPD. Chest X-rays or CT scans. These show structural damage in the lungs, like overinflation or emphysema. Arterial blood gas test, used in severe cases to check oxygen and carbon dioxide levels. The GOLD stages for COPD severity provide a clear framework to classify the extent of airflow limitation in people with chronic obstructive pulmonary disease. As COPD progresses from GOLD 1 to GOLD 4, the disease increasingly affects lung function and a person's quality of life. Although COPD cannot be cured, treatment focuses on managing symptoms, improving quality of life, and slowing disease progression. Treatment includes medications, bronchodilators to relax airway muscles, inhaled corticosteroids to reduce inflammation, mucolytics to thin mucus and make breathing easier. Oxygen therapy for patients with low oxygen levels, pulmonary rehabilitation, a program that combines exercise, education, and breathing techniques. Surgery. In advanced cases, procedures like lung volume reduction or lung transplantation might be considered. Prevention plays a critical role in reducing the burden of COPD. Quit smoking. It's the most effective way to prevent and manage COPD. Avoid pollutants. Protect yourself from occupational dust and fumes. Vaccinate. Stay up to date with flu and pneumonia vaccines to avoid infections that can worsen COPD. Healthy living. Maintain a balanced diet, exercise regularly, and manage weight. That's all for today's video on COPD. Found this video helpful, give it a thumbs up and share it with others. Don't forget to subscribe to Medicotes for more simplified medical topics. See you in the next video.